Hi, everyone, and welcome to the National Council of Urban Indian Health's virtual dialogue, VaxChat 2023, Paths to Equity. My name's Tiffany Stark, and I'm one of the public health program managers here at NCUIH. And also joining us today is my colleague, Micah Grant-Hunthrup, who is one of the public health project coordinators here at NCUIH. Micah and I will be your hosts today, and we would like to thank you for volunteering your time today to participate in the discussion. We at NCUIH appreciate your willingness to share your personal experiences with vaccines for COVID-19 and beyond. And we do understand that it can be a sensitive topic, so this is a safe place. Please feel free to share as much as you feel comfortable sharing. There are no right or wrong answers, and we know everyone's in a different place with capacity and vaccine progress. So this is definitely a chance for us to all learn from each other. Again, we are very pleased that you could join us today. Your answers are very important and will allow us to further understand the needs around adult vaccinations, specifically around COVID-19, the flu, and how NCUIH can further assist with any barriers as well. If you do have any IT difficulty during today's call, please chat directly to Comms and Events, and Lamar can further assist you. And then finally, if you could, please enter in your name, UIO, or external organization, and any tribal affiliations into the chat box. That way we can get to know each other and also count your attendance. And some quick housekeeping items before we begin. We would like to review the video capability option. Please enable your camera. This will definitely help to create a more interactive environment for us all. And also please note that your microphones are muted, but you have the opportunity during the virtual dialogue portion to provide any questions or comments. And you can also raise your hand at the bottom if you'd like to be called on, or just unmute if there's silence and pop in. And our chat box will also be monitored as well. So please feel free to drop any questions or comments throughout the presentation, and we will address those at the designated time. And also please note that this session will be recorded for educational and quality improvement purposes. Next, we would like to make note of our evaluation link and QR code. This will definitely be helpful for us to know how to better support you in the future. And we also will give a token of appreciation for folks who attend and also complete the evaluation. And we would also like to provide an acknowledgement. So this content was funded in part by the cooperative agreement with the Centers for Disease Control and Prevention. The Centers for Disease Control and Prevention is an agency within the Department of Health and Human Services, and the contents of this resource do not necessarily represent the policy of CDC or HHS and should not be considered an endorsement by the federal government. And we would like to provide an about NCUIH for some folks that maybe are newer with us. So the National Council of Urban Indian Health, or NCUIH as we like to say for short, is the national nonprofit organization devoted to support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. And taking a look at our agenda, so we will provide a brief year in review, then review our present vaccine equity focus, and move into our VaxChat discussion, and also have some questions and comments before we conclude. So to start, you've already heard about me and Micah, but again, we are your hosts today, so thank you so much. And then on the next slide, we would like to show the rest of the team who's a big support. So we have Thomas, who's our director. We have Lamar, who's our comms specialist. And we also have Alec, who is our statistician. Alrighty, so for the Vaccine Equity Project overview, this grant is focusing on building evidence for improving vaccination coverage and to implement strategies to reduce racial and/or ethnic disparities in adult vaccination coverage. This award funded organizations like NCUIH to implement activities that focus on reducing these disparities in vaccination for flu, COVID, and among the racial and ethnic adult populations that experience disparities throughout the performance period. And so taking a quick look at our past year, so year 2 lessons learned, we had a lot of successes with our Be a Good Relative campaign. We also attended the NAIS What's Up with Flu in 22. We had partnerships with AVAC and IDPN. We also are currently working with Good Health TV, and we also had our Community of Learning series, Journey to Healthy Communities. For year 3, which is our current year, we are completing this virtual dialogue, which will also supplement the content for our Community of Learning series this fall. So that will be in October, November, and January. We also have our Raven reporting, which is done quarterly. And we also continue to share updates with the National Partner Network to health organizations and equity groups. And for this current year, we are focusing on COVID-19 vaccine and boosters, of course, as well as flu and annual vaccines, as the annual vaccines have been kind of overlooked with the whole focus being on COVID for a while. So definitely important. And next, we would like to provide some information on CDC's Partnering for Vaccine Equity program specifically. So thank you to our CDC Vaccine Equity team who provided these updates for us. So as you may know, CDC launched the Partnering for Vaccine Equity program, or PAVE as we like to call it, in 2020 to advance equity in adult immunization for racial and ethnic minority groups through partnerships that drive community level action. So while the program initially focused on the urgent COVID-19 and influenza vaccine rates, it has built a far-reaching network of national, state, and local partners that are improving equity by reaching people directly in their communities through vaccine sites, town halls, educational materials, campaigns, and more to advance vaccine awareness, access, availability, and confidence. So also equipping ambassadors and influential messengers nationwide who represent racial and ethnic minority groups to implement tailored community-based vaccine activities and deploy culturally and linguistically appropriate educational campaigns. And also engaging people online through social media, including campaigns that mitigate vaccine misinformation, as that was a big thing as well. And in addition to funding support, CDC provides learning and data technical assistance, guidance, and communications to partners to support the efforts. So the vision of the PAVE program is to improve equity in adult immunization across disproportionately affected populations, including racial and ethnic minority groups. So the core to this strategy is establishing and growing a network of partners and community level organizations that support the racial and ethnic minority communities with vaccine confidence and access. And so taking a look at the federal fiscal year of 2021 to 2022, the PAVE program has provided over $230 million in funding to more than 500 national, state, and local level organizations. So from May 2021 to December 22, the efforts along with other PAVE partners have made more notable impact throughout the nation. So specifically in the last years of the program, partners have educated, trained, or empowered more than 258,000 community level spokespersons. 2.72 million people have attended promotional events, and 201 national educational campaigns have been launched. And additionally, from May 2021 to December 22, PAVE minority-led medical and professional association partner efforts have contributed to more than 508,000 clinicians being reached through new strategies and resources. Over 1,000 healthcare organizations have been reached through any new strategies and resources, and 168 trainings provided for individual clinicians or individuals affiliated with the healthcare organizations. So now with that better overview of the project, we would like to move into the Vax chat discussion specifically. So please note that we will have some polling questions that will pop up on your screen with questions, as well as specific slides dedicated to one question each to foster more discussion. So now I'll pass it over to Micah.
Hello, everyone. And just a note that we will be monitoring the chat box. So if you would like to put your answers there, you can as well. This first question is a poll, and it is just what vaccines is your UIO focused on? So we have COVID-19, the flu, MMR, HPV, and pneumonia. And if you have another vaccine that you're focused on, feel free to drop that in the chat. Okay. I think that's about everybody. We'll give it just a few more seconds, and then we can move on to the next question. Thank you. So our next question is, do you still see hesitation on COVID-19 vaccines, or do you see any hesitation with any other vaccines? And if you do, are there any measures in place that address vaccine hesitancy? So feel free to drop your answers in the chat or come off of mute for this one. Right, so we do have a comment in the chat is from Erin, and she says that one of their grant goals is to develop a social media campaign surrounding vaccine and COVID-19 vaccine hesitation. That is a great thing to hear, and I'm very excited, really excited to hear how that goes and to follow that campaign. Thank you for sharing. Has anyone seen anything specifically with patients in your community or even just family members? Okay, we can move on to the next question, but feel free if you think of something to either pop it into the chat or come off of mute and a pause and let us know. Our next question is another poll, and it is, do your patients still ask about the COVID-19 vaccines or the boosters? I'll give everyone a few minutes to answer that one. So we do have a comment in the chat from Liz that moms of teen boys have been spreading misinformation regarding heart issues due to the vaccine. That is interesting. I hadn't heard that, and that is good to know. Thank you, Liz.
It's nice to see that folks are still asking about the COVID-19 vaccines and
Yes,
boosters.
looks like we're getting the majority of people still have people who ask. That is good to hear, especially as we head back into flu season. Okay, we can move on to the next one. Thank you all for participating in that poll. So what sort of cultural approaches are or have been effective within your communities to promote vaccination? And how are providers or other community health workers utilizing relevant and culturally competent approaches? Oh, we have another comment in the chat saying that a provider outside of the IHS Urban and Tribal Health System has shared that the vaccine is causing her issues too. That's interesting. We'll have to look more into that. Thank you, Eddie. We move on to the next question, but feel free if you think of something, you can come off of mute at any time. We are not going to hold you to whichever question's on the slide. So we'll move on to the next one. So often individuals feel most comfortable receiving health information from or discussing it with trusted community messengers who may not necessarily medical professionals themselves. And so where do people in your community first look for information about the vaccine, or who is a trusted messenger or source who can or does promote vaccination within your community? For this question, I'm going to pick on Mr. Angel Galvez from Bakersfield to see if he has any thoughts that he might be willing to share. Angel, if you're speaking, we can't hear you, unfortunately.
Hello?
Oh,
Can you hear
there
me?
we go.
Oh, wonderful. Sorry about that. I was
No
navigating my
worries.
headset here. I was typing in the chat, and no worries, no problem. I think in terms of us, it happens through a couple of different means. One is we host and facilitate talking circles across many of the different groups. Like, for example, we have talking circles for veterans, talking circles for women, talking circles for youth. And in these spaces, the facilitators, which are often like our community healthcare workers or our cultural coordinators, and also like our peer support specialists. So think of them sort of kind of like your trusted community or trusted individuals who they feel most comfortable with, because they spend the most time with them on a weekly basis. And that's kind of where I see a lot of this information sharing happening the most, and it's most effective, because in the talking circle, it's a safe space, but also the information dissemination piece, they get it from like the providers or the organization. And so we're equipping them with proper messaging. And so for us, I think like in terms of they just kind of sort of seek that information in those spaces. And then they do really see them as trusted messengers. You know, earlier you had a question too, and I just wanted to make a quick comment because I didn't get to finish my typing, was about the information about COVID. You know, what is the ongoing questions or comments that are coming from COVID? And you know, we do get a few that have the perception that COVID is over, that, you know, there's no longer no COVID, or COVID can't necessarily harm me as it was harming folks in the past. And so we try to, again, confront those kinds of messages through these various platforms of talking circles. So for us, it's really on the cultural and traditional side that we find information being most effective. And so we have, just for the record, we have Tuesday, Wednesdays, and Thursdays where we facilitate these talking circles, and they generally happen some in the morning with like our elders. Our elders are more, you know, late morning type of folks, and so we have talking circles for them. But in terms of like the cultural groups, they're going from like 6 to 8 o'clock at night, and in those spaces we do see a lot more engagement with you know, youth, grandchildren, transitional age youth, and young adults. And so that's sort of kind of like the demographics for us. I hope that helps.
It does. Thank you so much. Those were some great thoughts, and I did write them down. So excited for that. Thank you, Angel. We really appreciate you. Does anyone else have anything that they would like to add or expand on? And if not, that is okay. We can always come back to that and move on to our next question, which is another, which is what have you heard discussed in your community regarding vaccines? Do people in your community express vaccine hesitation? And are there specific vaccines that people within your community avoid? So we now know that we've been hearing that some people have been concerned about heart issues due to vaccines, but are there any, other than COVID, are there any specific vaccines that people avoid, or is it specifically the COVID vaccine?
This is Evie. I just want to share that from my own personal tribal community, I've heard actually twice. And this is just like through family gatherings and extended relatives where they will openly express how, because they caught COVID, maybe the first or second time, they're immune to it, that there's no need for them to get a vaccine. So, I mean, I've heard a couple of individuals in a non-formal setting, like much more of a community level, family, extended relative gathering, where they express those things. And so, and that conversation came up only because the family host, was encouraging folks to wear masks. And so it was just that kind of side conversation happening with other extended family members expressing that type of opinion and stance. So I'm not sure across Indian country, in our communities, if similar conversations or stances are occurring, but I just wanted to share that experience and what I was able to hear in that particular moment.
Thank you, Evie. Yeah, that is good to hear. And these don't necessarily have to be, provider or formal settings. Those community settings are really important to hear from. So thank you for sharing that, Evie. Do you have another comment from Angel in the chat where he says that the younger adults are avoiding further vaccinations such as boosters because they feel resilient based on past vaccinations, and that the clinic does not see much masking taking place. So thank you for sharing that, Angel. Yeah, I'm sure that is pretty common. I know in my community, masking is pretty rare in general, even at healthcare facilities. So
I do have an additional question because I've heard the discussion in another meeting, but I'm curious if folks in this meeting have anything to contribute to it. But is there any hesitation with any pregnant women regarding vaccinations, especially with like the COVID flu that you have heard for this season?
That's a really good question, Tiffany. We do, because we lack women's health programs, and we lack like the provider serving specifically like the maternal population or expecting mother population. We don't have a whole lot of data, or we haven't surveyed that community of focus, if you will. But generally, I think generally what I'm hearing from like from our doctors that when they're having these conversations through the network, that there is a perception of concern for expecting mothers, and generally there is some hesitation on vaccinating. I think the masking is something that is not of an issue because again, it's kind of like coming from the perception of the mother that if they don't get sick, the fetus is then safe. So but in terms of like getting the actual vaccination, from what I'm hearing in discussions with the medical directors, that yeah, generally mothers are a lot harder to convince to get vaccinated until they know that their baby's born, and then at that point they make decisions, right? But that's sort of kind of just the information that I'm hearing from the medical director.
Yeah, that's very helpful. Thank you.
Yes, thank you. Well, I will pass it back over to Tiffany for our next slide.
Thanks, Micah. So now we'll have a fun little poll pop up. So are your patients staying on top of the annual vaccines? Give it a few more seconds, but it's nice to see that it's moving up for yes. All right, awesome. So yes, definitely the majority of patients are staying on top of their annual vaccines, which is great to hear. So awesome. Thanks so much for your participation in that. And then to help with that, do you send vaccine reminders to your patients? Give it a couple more seconds, but hopefully this one stays at 100%. All right, awesome. Yes, 100% for vaccine reminders. Great to hear. And then we have another question before we move into a fun activity. So how could NCUIH better assist you with your UIO for COVID-19, flu, and annual vaccine materials? Is there anything specific that you would like help creating, like an infographic, or just anything that would definitely be of better assistance for you with these vaccines? Yes, and we do have a comment from Angel in the chat. So infographics would be great. Yes, those are always fun, but also very informative as well. So definitely awesome to have for sure. Yes, incentives are always great enticers too, for sure. And then we have another comment, infographics and cultural competent animated commercials. Yes, definitely. We've had a lot of fun creating the vaccine promotion videos in the past. that I hope everyone has had the opportunity to see. If not, we could drop the links for you. But we have created some commercials that touched on trusted messengers, flu, our elders. So that's always a great component as well. And that could also be found on the Good Health TV network if the UIOs who are on this call have that subscription. You could definitely find some of our videos on there as well. I think they play 2 in rotation. So definitely check that out if you can. Any other materials that would be helpful before we move on to the next activity? And no pressure, if you think of anything else while we go into the next portion, you could always put it in the chat box too, for sure, and we'll take note of it for you. All right, awesome. We could now move into the next activity. So I will pass it over to Micah.
Yes, so we are now going to be asking you a couple more questions, but we decided to do it in a slightly more fun and interactive way. So Lamar, if we could switch over to the Jamboard activity. And I will drop the link in the chat. So if you would not mind just clicking on this link, and it should take you right to it. And if it doesn't, that's totally okay. You can put all of your comments in the chat. That is totally acceptable. But how this works, if you've never worked with Jamboard, is so those icons on your left are going to provide you with different options. You can use sticky notes, text box, pins, whatever exactly. We've got some people playing with it already. Perfect. So we can move on to the next slide. So our first question is, what kind of vaccine resources would be helpful to you and your patients? And I know we've kind of touched on those a little bit, such as the infographics and the commercials. Is there anything specifically that would help you when you're handing things out to patients or talking to patients? Feel free to pop those either on the Jamboard or in the chat. Seeing some people play with the sticky notes on the slides. Thank you. Transportation, that's a great one. Thank you for that. Thank you for that suggestion. That is a great idea. Infographics and reminders from the PCPs to vaccinate. That's a good idea. So this is another question that I just thought of. Feel free to just pop a comment in the chat or come on mute. But how many of you have your EHRs set up to remind your clinicians to ask about vaccines? It's okay if you don't know the answer to that too. We'll move on to the next question for now, but we can always come back if you have an idea. So is there a specific vaccine that you need more resources for in helping discuss with patients? So I know I've seen most of them are talk about COVID, flu, and pneumonia, but are there any other vaccines that you would like to focus on but don't have the resources to right now? Okay, we'll move on for this one from now. We'll move on to the next question, please. So do you have any other suggestions for improving vaccination rates within your community? So just any ideas that you have that might be helpful. I know that's a big question too, so. Events, that's a great idea. Community events. Fall is coming up. We do have some fall, I'm sure there'll be some fall festivals. And we'll move on to our next one. And then are there any specific outreach and education efforts that you do to ensure that communities with lower access to information are well informed about the vaccines and their benefits? Sorry that question is so small. I literally could not get it any bigger. And this link is active, so feel free, if you have a thought about a question we've moved on from, you can scroll back and add your thoughts onto that slide, no worries. No, these are the bigger, harder questions. Using the school district newsletter to reach students, that's a great idea. Being visible in the community, getting
And we
tribal.
do, oh, I'm sorry. There is a comment in the chat box from Bruce. Can I type my input in the chat box? Definitely, for
Yes,
sure.
of
If
course.
you don't have access to the Jamboard, you could definitely put your responses in the chat too, or come off mute. These are really good responses.
Yes, thank you, everyone. One of the reasons that we chose to do it this way is so that we can go back and review all of the responses that you put in on this document. So.
And
All right.
maybe, yes, no, perfect. Sorry, Micah.
I was just gonna say
Same
this
thought.
time I'll turn it back over to Tiffany for final thoughts and wrap up. But feel free to keep adding in your thoughts as you can. That is the last question, Lamar, so we're good there. But feel free to keep putting in your thoughts in that link or in the chat, no worries, and we will get all of those taken note. So Tiffany, back to you.
Thank you. Yes. So now we will move into our general questions or comments. portion of the event, because I know that we were asking a lot of questions. So now if there's any that you have thought of, definitely share. We're here for you and to learn how we could better assist you. And also in the meantime, too, we could also go back to the Jamboard to review the questions to see if there's anything else that was added. And please feel free to put it in the chat box too if you don't feel comfortable coming off mute.
So some of the comments from the Jamboard have been very great. Some people suggested mobile vaccination clinics, getting whole vaccine information, not just side effects or how to administer vaccines, but more in-depth information. That is a great idea. And we do have a comment in the chat from Bruce, who has said that for communities with low information, the best way to get the word out would be mostly physical, one-on-one conversations with diverse folks, or using institutions such as schools or religious bodies and various other places to help cover more grounds in the community, and then using flyers, billboards, and other visible means that can pass along the information. Bruce, those are all great ideas. So thank you so much for sharing.
Yes, that definitely goes along with meeting folks where they're at for sure. So those are all great points.
Tiffany, I just wanted to make a comment that also like the podcasts that you guys do, the learning sessions, and even interviews. I think interviews are like, especially with people who are comfortable talking about their own experience, whether good or bad, whatever the information is, it's all often perceived very honest. And if it's very genuine, then that's like the best way to get messages out, I think. So promoting that more, I know you guys already do a lot of that. And so that's very helpful for us because we share links, we share videos, and I think that helps sort of kind of also spread the message. I think where we're hiring a media specialist to help us with like some of those platforms that are catered for like the various age groups, that I don't know them all, but like posting on Twitter, posting on Instagram, posting on all these different platforms. There's so many, but getting that message out across all of those social media platforms is so critical. So we know you guys produce a lot of content like that, and I'm just hoping that once our media specialist starts the first ever position here with us, that individual can also continue to increase messaging in that way.
Yeah, that is awesome. I'm definitely glad to hear that you have that position coming aboard to help. And I liked what you said about the genuine like messaging in Messenger. That is definitely a big piece to it. And that's definitely one area that we had focused on too in our last year's COL, because it is so important to make sure that the message is genuine and that the information is true, especially with all of the misinformation that's out there because of the internet being so big. So it's definitely important to have those resources for sure.
Right.
Thank you, Angel.
Right. And I comment that I saw that in the comments. Someone mentioned like the religious, using the religious or using age, sex, and religion, really kind of spreading the diverse. And I think like even interviewing folks who identify with the specific religion, it's more for education, or like why do some folks on the religious point of view take the approach of whatever it might be? Because I do hear often like comments about that the vaccine is like the mark of the beast, but it would be very interesting to perhaps hear like the perception or the position from someone who maybe feels very strongly that it is like, where is that coming from, right? Because I think then that helps the listener hear why these comments are being made and where it's coming from, and the listener or the viewer can then determine to make the appropriate decision based on these interviews. People taking positions about the vaccine on this or that or on whatever front. So just thoughts and how we can better inform our community about proper messaging, regardless of what the message might be about.
Yeah, that's a good point. So definitely not being dismissive of somebody who may not understand or isn't, ready right away, but then to take that time to establish that relationship, that connection, and then help with the education. That's so important. Any other questions or comments that anybody has thought of? If there was something that wasn't mentioned that would be of help to you and your organization for the COVID, flu, and annual vaccines. If not, that's okay. If you think of anything else, you could add it to the chat and we will revisit that. But now we would like to move into the contacts and evaluation. So we have both Micah and I's emails listed. If you would, have any questions or want some more information. And then we also have the evaluation link and QR code listed. And just another reminder that for attending and completing the survey, we would give a token of appreciation for your time and feedback. And we also want to review some upcoming NCUIH events and funding opportunities. So the emerging leaders, I know that it's fresh off the press, but there were about 30 applicants for that. So that's amazing. And then looking forward to September 26th, there's a peer-to-peer solution center for HIV and AIDS resource toolkit launch. So very important. Mark that on your calendars if you're able to attend. We also have a funding opportunity for the ECR year 2 available. There's one spot. And we also have a forum that will be taking place on October 17th with presentations by Bakersfield American Indian Health Project and also CDC ECR team. So definitely save the date for that. More information to come. And then we also have saved the date for our Vaccine Equity Community of Learning series for this fall. So we have October 12th, November 9th, and January 11th of 2024. And then we also have some vaccine equity resources listed, and the slides will be sent out in the next few days. So if you want to refer back to anything, we'll have those for you as well. And also to make note, the vaccine promotion videos that we mentioned earlier are also listed in this as well. And then I just want to take a moment because I saw Micah put in the chat too. If you have any technical assistance requests, specifically for educational materials for COVID-19, the flu, annuals, you could submit a request for that link that Micah shared, and that will go directly to us. And then we could set up a meeting to discuss further on how we could better help you with that resource. But I want to thank everyone so much for taking the time to meet with us and providing responses. So thank you so much, and I hope you all have a great rest of your day.